Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's understand about telehealth and common services which comes under telehealth, and also we'll understand telemedicine, we have to when to use traditional telemedicine CPTs and when to use normal office visits. Okay, everything we will understand along with the modifiers. So please do watch video till end, and if you find it useful, please do subscribe to my channel and please do share with your medical coding friends. So let's begin. So what is telehealth? Okay, the first thing, the basic thing we have to understand is what is telehealth. So as you all know, telehealth is a broad term. So where they'll be utilizing the digital technologies to deliver wide range of health related services and information remotely. Okay, so it includes not only virtual visit with the healthcare provider, but also tools for education, scheduling consultation, and even administrative functions. Okay, so there are many other services can come under telehealth. So we need to understand all of those. Okay, so let's see few common telehealth services. So we have four common telehealth service. The first one is remote patient monitoring. Okay, simply known as RPM. So you can also get these RPM CPT codes under medicine section. You can just go and check. And patient here, what is RPM means? The patient will be utilizing the device to monitor their health metrics like blood pressure and send data to healthcare providers. So whoever their primary care physician will be there, for them they'll be sending the data of their vitals. Okay, so it can be BP measurement, like utilizing the BP device, measuring device, and also they can also share their blood glucose level. Okay, so utilizing some device, they can monitor their health metrics and they'll forward the data to their healthcare provider. Okay, so that provider can monitor their own patient health status, and accordingly they'll start or they'll give the comprehensive treatment plan. So next one is mobile health, in short M health. So here apps that provides educational resource, reminders and health guidance. So the like we are already using mobile apps where we will also be able to get the educational resources, like what is the plan for my health condition. It can be dietary resource or any other things, and reminders like at which time I want to take this medication, or maybe not only medication, it is like just reminding you on timely basis for whatever the work or whatever the thing you just have to do regarding your own health. And health guidance, okay, everything will be provided through mobile health. Next, other two things are very important. One is synchronous telehealth and another one is asynchronous telehealth. So let's understand in short what is synchronous telehealth. Synchronous stands for it's a real time communication, like video consultation with the doctors. Okay, it's a live. So you are both parties, like you if you are a patient, you should be available and the provider should be available in the same time, and you are connecting via video and you are discussing about your health concern. Okay, both parties are on available on same time. That is called real time conversing. Okay, so it can be through audio only or it can be through audio plus video. Okay, so that is if it happening in a real time, you should consider it as synchronous telehealth. So this synchronous telehealth is nothing but telemedicine. Okay, so those synchronous telehealth we will be coding under telemedicine section. So later I'll explain that. And then asynchronous telehealth, it's a transmission of patient data. So in general word we say store and forward. Okay, so you are having some concern about your health, or maybe you are just capturing the everyday day to day symptoms. Okay, if it may be assume it is related to dermatologic condition. Okay, so you are getting some patches where that patches is every day it is like getting more and more redness, or maybe it is just progressing. So that what you will do, you will start capturing those images and you'll start sending to the provider. But when it comes to asynchronous, here you cannot have a real time conversation with the doctor. Okay, whatever the concern or images or whatever the request you have, it will be stored and then it will transmit. Okay, after certain time or certain days, it will be transmit to doctor, where doctor will review. And whenever he doctor is going to review your report or your whatever the images you have uploaded, so then he will give his opinion. Okay, then he will respond for that. Okay, so it cannot be a real time. And here both parties will not be available at the same time. You are a patient, provider is like you cannot access the provider in real time. Okay, that is the meaning of asynchronous telehealth. So asynchronous telehealth, we have a separate CPT code set. So again, that also you can check in medicine section. And then coming to synchronous telehealth, so let's understand more deep of it. So synchronous telehealth involves live real-time communication between patient and healthcare provider. The interaction mimics a traditional face-to-face visit but occurs via technology like or video conferencing or phone calls. So here, uh, like when you are considering synchronous telehealth, so here the evaluation will be more effective since the doctor is available and he can actually see you, and he can also he can general appearance. Okay, what is your general appearance, he can able to see. So based on that he will have the judgment, and he can maybe he can go ahead and prescribe what is needed for you. Okay, that evaluation will be done effectively when it comes to like video conferencing. Okay, so here example you can see live video consultation for acute symptoms, virtual follow-up visit, and real-time specialist assessment or referral. All of these can be done utilizing synchronous telehealth service. What is the benefit? So benefit, as I mentioned earlier, you will be able to get an immediate feedback and diagnosis, and also real-time communication builds this the particular support and trust it will build, and ideal urgent or real-time sensitive care. So all the benefits you will be able to get in synchronous telehealth. It is like more of you are actually going and taking a walk-in visit. Okay, so he will be there and he will be seeing you through video, and he will be able to evaluate by seeing your general appearance. Okay, so that is synchronous. And again, coming to asynchronous telehealth, so here, as I said earlier, asynchronous telehealth, often called as store and forward, and it does not require both parties to be available at the same time. So patient can submit the medical informations like photos, videos, and documents, which provider going to review later. Okay, which provider reviews later and respond to accordingly. Okay, it is like there is like he cannot you can't expect like, okay, morning I have sent the data, by evening I should get a feedback. Okay, this will not be possible, it will take some time. Okay, certain days will happen and then they will respond. And then what are the benefits? Benefits like offers flexibility for both patients and providers, efficient for non-urgent and routine evaluations. So if it is urgent medical conditions and if you are feeling it's an emergency, then you definitely cannot choose to go with asynchronous telehealth. Okay, you should go, at least you should take the synchronous telehealth, or you should directly go to clinic. Okay, if you feel it's an emergency condition. Okay, once you are not feeling like it's an emergency, you can take some time and you can wait for his doctor's opinion, and it can save time and improve documentation quality. So these are some benefits of asynchronous telehealth. So as I mentioned, we have separate code for asynchronous telehealth. And next, now we'll understand what is telemedicine. So is the telemedicine and telehealth is same? So this is the question I'll be keep getting. So in telehealth, we have discussed synchronous service and asynchronous service. But when I'm talking about telemedicine, you should understand it should be a synchronous. It should happen in a real time. Okay, that is the difference. It should be synchronous and the both parties should be available. And the doctor who is evaluating the patient, he must document the diagnosis also. Okay, so then you can consider it is a telemedicine visit. So you can see here, telemedicine on other hand is a subset of telehealth. It refers to remote diagnosis only. It is also a remote diagnosis and treatment to the patient using telecommunications technology. So think of telemedicine as a clinical side of a telehealth. So here it's a clinical side. When I say telehealth, it can be clinical side or it cannot, like what we say. Both clinical side and non-clinical side can happen utilizing telehealth service. But when I specify it's a telemedicine, then you should understand it's a clinical side. Okay, we are seeing the doctor because we are suffering from some symptoms, some acute symptom where I really need to get evaluated. So I may not able to go to hospital or a clinic, but at least I can take a telemedicine visit. Okay, like video conferencing I can take. Okay, this is in short, you can understand in a simple way. And then, like, they can prescribe, they'll give the diagnosis after seeing the patient, after evaluating the general appearance of the patient. Then he may suggest to, or he may prescribe some medication also. Okay, and he can capture some diagnosis. And say for example, you are seeing very dull, I mean your appearance is looking very what to say, you're not, by seeing I can tell you you're not well, you're feeling so weak. Okay, that he can capture in general physical examination. He can mention like patient appears to be not well, or patient appears to be weakened. So all those word he can utilize and he will capture that. So then telemedicine service offers numerous benefits, so such as patient to access the specialist who are far away, for reducing needed in-person visit for minor alignments. So if, as I mentioned, you are staying somewhere far from the city and you cannot immediately go and see the specialist, so by utilizing telemedicine service, at least you can contact specialist from the comfort of your home. Okay, that is what the importance of telemedicine. So now, what are the documentation required for telemedicine? So there are 5 documentations must and should we should be having in the record. That is patient informed consent. So this consent form is very important. Okay, the patient who is taking the telemedicine, he should have that consent. Okay, so maybe every time whenever you take telemedicine appointment, every time you should fill the consent. Okay, so that is the importance of consent form. And then patient location. Okay, so this documentation can include where is this patient is at the time of the telehealth. Okay, so it is included, what to say, like it may be like many patients be at healthcare facility during the visit rather than home. Like if you remember place of service, when you are billing for telemedicine place of service, we have two POS. One is 02 and one is 10. Okay, one is like from the home and one is patient is staying in other than home location. Okay, so that is why it is important to specify from which location patient is taking telemedicine service, whether he is in home or other than home service. Likewise, the provider location is also must and should, it should be documented. Type of equipment used. Okay, so type of equipment here, they should document what kind of mode they are taking, whether it is a synchronous or asynchronous. Synchronous is real time and that should be coded as telemedicine. So that we need a data, whether it's a synchronous visit or asynchronous visit, that should be captured properly. And also audio, video, remote monitoring, all the specifications we have. Sometime audio only visit, audio plus video, all those specify, the documentation should specify properly. And total time spent. Okay, so when I say telemedicine, here we follow both the guideline, MDM guideline and time specific coding guideline. So that's why how much time he's spending via video call, that much time he need to capture in the medical record. By seeing time, I can select my CPT codes. So you can also see CPT uses the symbol to denote whether the service can be performed through audio, video, or through audio only. So here it's in a simple way. Just see the images. So you open your CPT book, and in CPT book check for Appendix P and Appendix T. Okay, in these sections they have listed the services. Like what are the services should be performed using telemedicine. Okay, telemedicine means the both audio and video conferencing. So that CPT codes will be having star symbol with that. Okay, and it can be performed through audio only. Like some services can be performed through audio only. Audio is sufficient. So those kind of CPTs will be listed with this audio symbol. Okay, so just go ahead and check Appendix P and Appendix T in your CPT book. You will be able to understand. So next, coming to Medicare telemedicine service. So this you should understand. So other except Medicare, other commercial payers may utilize the traditional telemedicine CPT codes, but when it comes to Medicare services, Medicare will not pay for traditional telemedicine CPT codes. Okay, we need to utilize office visit ENM codes. Okay, so how we will code for Medicare? So once you get to know this is a Medicare patient, like who has the Medicare insurance as his primary payer, then you should check like is it a telemedicine. First confirm is it a telemedicine visit or not. So once you confirm the telemedicine, check for the time coding guideline or MDM coding guideline. Say for example you got moderate MDM. Okay, moderate MDM, new patient, moderate MDM, you will be getting 99204. Okay, so for this 99204, you are going to bill even though it is telemedicine visit, because payer is Medicare. And with this 99204, you are going to utilize 93 or 95 modifier. Okay, or sometime it's not sometime, it's like you have to utilize the POS. Okay, saying patient was at home or patient uh, not at home. So POS 02 is patient is not at home, patient at home, POS 10. Okay, these two POS we have, we will be utilizing this POS. And if it is audio only visit, you can utilize 93 modifier. If it is audio plus video visit, then you can utilize 95 modifier. Okay, but you will be billing office ENM visit. Okay, with this you will assign appropriate modifier and appropriate place of service. So this guideline will be applicable only for Medicare payer. And few commercial payers, if you have any particular SOP, like if that particular commercial payer is not ready to accept traditional telemedicine CPT codes, that is 98 series, then again for them also you can follow same method. Okay, you can use the office ENM visit and you can use appropriate modifiers. Okay, so you can see, so sometime in telehealth, maybe audio only when patient is at home and unable to choose not to use audio plus video. So sometime provider like patient will not be so comfortable with switching on the video. So that time if that is a case and they are not able to switch the video, then the provider should document that. Okay, so provider must able to use audio and video. Provider side, he should, if he is saying audio plus video, then he should have that report like he has used both the method audio and video. But, for patient end, if the patient is willing to talk but not willing to switch to video, then it is up to that patient, but the documentation should come in the medical record. Okay, so that's what provider should document a reason for audio only. Okay, next, you can just see the codes here. CPT codes, audio and video new patient. So this is audio video, both utilizing synchronous, both audio and video. And if patient is new, so what are the codes we have? We have four codes: 98000, it is for straightforward MDM, and 15 when using total time, 15 minutes must be met or exceed. And then 98001, it is for low MDM, and at least 30 minutes must be met or exceed. Okay. And then 98002 is synchronous audio visit for evaluation and management of new visit, including medically appropriate history, moderate medical decision making. And if using total time, at least 45 minutes, 45 minutes needs to be met, then you can utilize 98002. And 98003 is for synchronous audio video visit, which is IMDM, and while using total time, 60 minutes of total time on the date of encounter must be met. So here prolonged services also you can utilize. Okay, remember prolonged service code is 99417. Okay, for additional 15 minutes you can code 99417 along with 98003 code. And then coming to audio video established patient. So 98004 straightforward 10 minutes while using time. 98005 low MDM while utilizing time 20 minutes. 98006 moderate MDM 30 minutes of total time. 98007 high MDM 40 minutes of total time. Okay, so both new patient and established patient. And when the provider is utilizing both audio and video, okay, and when it is synchronous, we will code from these section. These are traditional telemedicine audio plus video CPT codes. Okay, so next we have audio only. Only they are utilizing only communication, telecommunication, but not video. Okay, so that time for new patient we have 98008, 98009, 98010, 98011. So please check the specifications. Straightforward with 15 minutes 98008, and low MDM, and when utilizing time must be 30 minutes 98009. So it goes on, and this is for new patient. These four code belongs to new patient. Same way for audio only established patient, we have another set of four codes: 98012, 98013, 98014, and 98015. Okay, so these are all the synchronous audio only visit. Say for example, you got synchronous only audio visit, you will check the MDM or you will check the total time, and then you will check whether this patient is new or established. Accordingly, you will select your CPT code. Okay, simple. So next, let's have a quick look. One example we'll see. So see here, scenario 1 is patient is established patient and he has taken both audio plus video. So total thing they have performed is straightforward MDM. Okay, straightforward MDM, 12 minutes of total time. Total 12 minutes they have spent. Provider is in office, patient is at home. Okay, and commercial payer. Payer is commercial payer. So easy, you are going to bill established patient. You can see audio plus video, straightforward MDM 98004. Okay, this is your code because we are billing for commercial payer. No need of any modifier when you are billing traditional CPT codes. Okay, 98004 is enough. Okay, so answer is, you can just see straight 98004. This is enough. And modifier, you don't have to utilize any 93 or 95 modifier. No need of that. Okay, one CPT code is enough. And POS, you will just show that patient is at home. So you can utilize POS as 10. And second scenario, So here established patient, audio only visit, not audio plus video, only audio visit. Moderate MDM, 30 minutes they have spent. Provider at clinic, patient at home. And Medicare requires traditional office visit. So here patient is having Medicare as their insurance payer. So what we will do? We cannot code these traditional CPT codes. These traditional telemedicine CPT codes we cannot use because payer is Medicare. So what I will do for established patient, moderate MDM means I will utilize 99214, okay, 214, and then I will also utilize 93 modifier, synchronous telemedicine via audio only. Okay, so here I am showing with the 93 modifier, where this 93 modifier is specifying audio only, and TOS 10, patient is at home, you can utilize. Okay, so this is how we will code. And if you are if you want to know about asynchronous, okay, I'll just show you those asynchronous visit. And telecommunications also we will be having. So see here, these are the telemedicine service. And for the service that are asynchronous, we are going to take online digital evaluation and management service from the series 99421 422 423. So you can go ahead and check for these CPT codes for asynchronous visit. And also there is one more guideline we have for audio only telemedicine service for established patient with 5 to 10 minutes of medical discussion, report brief communication technology service, that is virtual check-in 98016. Okay, if it happens only for 5 to 10 minutes and it is only audio, okay, not more than 10 minutes, between 5 to 10 minutes only they are utilizing, and patient should be established, then you can utilize 98016 as your code. Okay, this the code description is brief communication technology service. Okay, maybe just to have a quick appointment they might call the and then they take. So for that 98016 we will use. And then so for Medicare, and also you can just check this chart. So see, brief synchronous communication, established patient only. So for single calendar date, 5 to 10 minutes medical discussion, you will use 98016. And online digital ENM, which is asynchronous, you are going to use these two, this series of codes. Okay, so you can just check all of these things. Synchronous audio plus video and synchronous audio only. So there is all the updated 2025 updated codes, even though it is 98 series, these codes are out of numerical order in medicine section. So previously it was in medicine section. From medicine, they have shifted these codes, okay, CPT codes to ENM chapter. So under ENM, you can able to see. So many of the people are like they'll keep students like they'll say like they are unable to find these codes. So I'll just show you. See here, the updated codes are in the 2025 book, page number 18 and 19. Okay, previously it was in medicine section. So just see here. The code is like out of numerical order. Just a minute, I'll show. You can see here. 98000 code is out of numerical order. See ENM codes between 99214 to 99222. So all of these codes shifted from medicine section to from page number 882 it came to ENM section. Okay, so under ENM you can able to see all the new telemedicine codes. So please check the coding guidelines and check for the Medicare specific coding guideline what you will follow, and accordingly you can code it. So for CPC exam perspective, you can just follow like the new codes. What is whatever I've explained. What is synchronous? What is asynchronous? And when to consider it is telemedicine. All those, if you are aware, that is enough. And when it comes to modifier, okay. So we have other than 93 and 95. Sorry, which one I opened? So other than 93 and 95, we do have GQ modifier and GT modifier and also GO modifier. Okay. So if I'm billing for asynchronous telecommunications, I'll utilize GQ modifier. Okay. But it is only for certain jurisdictions like Hawaii and Alaska, they'll take GQ, and GT and GO also have some coding guidelines. Okay, so GT, it is for interactive audio and video telecommunication system, and GO is telehealth service for diagnosis, evaluation, and treatment. Okay, so not this is like pair specific coding guidelines. So that and all, no need for this session. So please check and check for the correct CPT codes when you are coding for telemedicine. So I hope everyone understood. Okay. So that's all for today. Thank you for watching. Please do subscribe and share with your medical coding friends. And if you are interested to join my classes, please do text me on this number. Okay. WhatsApp, you can text. Don't call, just text. Or else you can just visit to my website and you can enroll, so that I can get your contact and I will only connect with you via WhatsApp. Okay. Thank you all. Thank you for watching.